Hi, this is Diane, and welcome to DMD Digest. Today I wanted to talk to you about some problems that I've been dealing with for, I think, the majority of my life. And I think a lot of you who are tuning in can probably relate to this. So it all stems with GI upset, from constipation to diarrhea to gas, bloating, indigestion, heartburn. Some of the things that I've been talking about already. And I've kind of been talking about different things that we can use that might try to help some of these symptoms, things to look for, things that might help, might not help, just kind of that flood of information out there. So today I actually wanted to talk about the symptoms themselves and what some of you might be experiencing. As I said, as far back as I can remember, since being a child, I've dealt with GI issues, hence DMD Digest. So some of these things could be maybe you're just trying to deal with it on a day-to-day basis. Maybe you've had a medical professional actually diagnose you with something, or many of you are out there suffering like on your own in the dark, and you've gone to medical professionals and perhaps they've already started you on a different series of medication, maybe heartburn medication. A lot of those are called protein pump inhibitors, things like that you can get over the counter, as well as prescription, like Zantac, Pepcid, Prilosec, Nexium, those type of things. And those can be helpful. So we think, oh great, I can still eat whatever I want and take this medication and I don't have heartburn, or I can use Tums or Rolaids or some other medication and I don't get the gas or the indigestion. And for a lot of people out there, those things work. For some of us, those things don't work, or we end up having more problems. So that brings us back to now, what do we do? And a lot of people with these chronic conditions have gone to your medical professionals, as I've said, and it just becomes a process of, well, try this medication, try that medication. So come to find out, after I've looked into all of this and kind of gotten nowhere with people besides doing my own research, it ends up that kind of all of those heartburn-related medications that I talked about, the Pepcid, Prilosec, Nexium, Zantac, things like that, are really kind of backfiring on us. And they're only supposed to be used for about 2 weeks. And they're not supposed to be used continually, because what they actually do is decrease the acid in your stomach and create more, on the long haul, more gas, bloating, indigestion, diarrhea, constipation, more problems like that. So those type of symptoms kind of lead us into the next progression of, well, now what do I have? If it's more than just the heartburn, acid reflux, other things that you can be dealing with are irritable bowel syndrome, which is also known as IBS. You can have 2 different variations of that. You can have more the diarrhea component, or you can have the constipation. Sometimes people have a little bit of both. You can have irritable bowel disorder, which is even more complicated and actually more of a chronic kind of worsening of that condition. There's other conditions. One that's actually getting a lot more publicity, and there's a little bit more information about it, is leaky gut syndrome. Well, what is leaky gut syndrome? Well, it's kind of a newer term, but what it means is that our intestinal lining from your stomach to your large and small intestine ends up having abnormal permeability, meaning that what you're eating, drinking, when it's being absorbed is somewhere along the line getting disrupted. So those particles of food that you're ingesting are leaking through the cell membrane in your intestine. And when it does that, it creates major pain, gas, bloating, cramping, nausea, sometimes vomiting, sometimes constipation, sometimes chronic diarrhea. Sometimes your stools, what you want to look at, or your bowel movements can be mucousy, they could be bloody, they could be oily looking. None of those are normal. So that's kind of what leaky gut syndrome is. And as I said, there's more and more information coming out on this. And we know that our gut flora, also known as your microbiome, which I've talked about in previous videos, is kind of the foundation here. We have just trillions of bacteria in there that are the good guys that we don't want to get rid of. And I've talked about ways to try to feed those and get more bacteria into your gut, the good guys, which help to digest and break some of those foods and things down and help to eliminate some of those symptoms that you're suffering with. But tonight or today, we're going to talk about just the disorders in general and what all is encompassed by those. So in addition to leaky gut, other gastrointestinal ailments could be Crohn's disease. Crohn's disease can be a very severe ulceration actually in your intestines, where you are having very severe pain. You end up having the inability actually to absorb a lot of the nutrients. So there can be a lot of weight loss, a lot of fatigue, a lot of exhaustion accompanied with that. Some of these things are considered autoimmune diseases. So your healthcare provider should be looking at blood work and looking at white cells and looking at, there's just a multitude of different tests that you can look at to try to identify what's causing this. And do you have any other autoimmune symptoms or diseases that could be affiliated? Another condition is called exocrine pancreatic disorder or insufficiency. Short abbreviation is EPI. And that's a whole nother type of GI issue, and that involves your pancreas not producing enough enzyme, or maybe not in the right quantity. And when that happens, those enzymes coming from your pancreas help to break down those foods so that they can be digested, so that they can be eliminated, and so that you also can gain the fuel and the energy from the foods that you're eating. So when your pancreas is disrupted and it's not able to secrete those enzymes that are needed, you can also have nausea, vomiting, gas, bloating, severe pain, constipation, diarrhea, and you'll notice that your bowel movements may be oily, greasy looking. Another condition to look at would be diverticulitis or diverticulosis, which is an inflammation in the intestine, once again, where food and certain particular foods will cause those little pouches in your intestine to protrude and pop out, which is extremely painful. Another condition is called SIBO, which is small intestine bacterial inflammation. It is kind of a whole nother thing. It all, once again, involves very similar symptoms. So as you can see, there's a lot of different possibilities here when you're suffering with digestive problems, when you're suffering even with the heartburn, the esophageal reflux problems, and it's an ongoing battle. So today's presentation was really just to kind of educate you on all the different types of gastrointestinal problems that you may be having. And those symptoms can kind of cross over, as you notice that a lot of those same symptoms fit almost all of those different diagnoses. So that makes it very confusing as well. Which one do I have? So kind of on your own, look at what are my symptoms, when do they happen, does it get better or worse depending on certain things that I eat or drink, and you really want to start keeping a food diary of what is it that seems to make it better, what is it that seems to make it worse. And remember, if you eat something and you get sick, vomiting or diarrhea, something of that nature, it may not be exactly what you just ate. Because as you know, it takes several hours, and for some people with digestive issues, it can take days before what you eat today gets all the way processed and you actually eliminate it. Other people, their bodies are working much quicker. If you're suffering with diarrhea, what you're eating is going through your system much quicker. So being able to identify what is it that I'm eating and when do I start to have symptoms. That also is kind of rule of thumb to use if you are prone to food sensitivities or food allergies. Once again, you'll want to keep a track of what seems to make it better, what seems to make it worse. As an example, dairy products. You wouldn't want to, if you think that might be something that you're sensitive to, you wouldn't want to eat a regular meal and then also like drink milk with it or have cheese or cottage cheese or a milkshake, whatever. Try to eat the food that you think you might be having a problem with separate, and don't overload on it. So we know that dairy, I mentioned cheese is one thing. Cheese can be really difficult to digest. So people who have GI problems, whether it's constipation or diarrhea, we know that cheese tends to be constipating. So you would want to be cautious with that if that's one of your problems. But even with diarrhea, if you have a lactose intolerance or and just any type of dairy sensitivity, sometimes that will just kind of go right through you and you'll end up with diarrhea. So you want to, that's what I mean by kind of isolating whatever it is you're trying to see if you're sensitive about, and just do a small amount of it and try not to mix it with any other food and see how you do. And you want to do that for several days in a row so that you know for a fact, yes, this is problematic, or no, it's not. That was just one example, but just kind of wrapping it up, just to try to give you some idea between GI symptoms that you're having, starting from your esophagus, your throat, when you're swallowing, all the way to eliminating, and the different types of diagnoses and illnesses that it could be. You want to be able to try to isolate as much as you possibly can before you go to your medical professional, because they're always going to start with, what's the easiest thing to address first. And be cautious that you don't walk out of your medical professional's office with even more pills to take, because we know and we're learning more and more about the medications that we're taking to neutralize our stomach acid. Like I'd mentioned, the heartburn medication, the antacids, those type of things actually in the long run make it worse. So you don't want to do that. You also want to be cautious if you're on an antibiotic, because we know that antibiotics wipe out the good guys, the good bacteria in your intestines, which you want. We actually want more of those so that we can digest our food even better and we can fight off some of these symptoms that we're having. So, words of wisdom. Hopefully this was helpful to you, and I will look forward to meeting back again the next time, and we'll talk a little bit more about your digestion and what makes it worse, what makes it better, and ways to help. Thank you.